Hey guys, what's going on? Dr. Chad Kuntz, and wanted to kind of have this presentation for you guys today since recently I've had a lot of people who have kind of reached out to me with the recent posts that I've had on Facebook where I kind of talked about, if we truly know our athletes are safe when they return back to the sport. I've talked to a few moms, particularly, their kids are trying to get back. It's football. In fact, some kids are getting ready for basketball, and even a few that are getting ready for wrestling. And you could tell that there's some nervousness, some anxiety with regards to the mom, because it's kind of like, I'm not quite sure if he's ready or not. The average cost for the surgery, at least for an ACL surgery, is $47,000. It's a year-long recovery. It's a lot of time and a lot of money, and that's just with regards to ACL. It's kind of somewhat true for the LCL, the lateral collateral ligament, your MCL, or the inside ligament, the medial collateral ligament, or the meniscus. Any one of those knee injuries could make it really difficult to get back to playing their sport safely and confidently, pain-free. In addition to that, insurances are severely limiting the number of visits that we've seen for clientele. So, I remember when I was in the corporate world, it wasn't uncommon for athletes and people to have 12 visits, 8 visits, as low as 6 visits for an ACL rehab for them to get back to playing their sport. And that's just an absolute joke. Don't get me started on that. That'll get me really fired up. And in addition to that, most of these moms have gone to typical, where the therapist is seeing anywhere between 2 to 5 an hour. Even if it was a one-to-one session, they felt like the therapist was just on their computer, or maybe they're doing documentation, they're taking phone calls, and they weren't getting that care, even though it was technically a one-on-one. And then lastly, most therapists and most locations don't have access to kind of that gym-like setting to show the athlete's sport requirements right there and then. Typically we're, as therapists, confined to a small clinic, and that makes it really challenging to really sink our teeth into the athletic movements that we need to see to justify, to determine if they truly are pain-free and ready to go. If we can have that confidence to say, yeah, they look great. I've seen him move. I've seen her move. We recorded it. We've analyzed it via slow motion. They're good to go. I'm a huge believer that I need to see things in front of me objectively. I like to take feelings out of the equation, particularly from others. Feelings can ramp up. We can get nervous. And sometimes it's not justified. Sometimes we're just nervous. We don't want it to happen again. And I totally get that. But if I can present some data objectively that, hey, your kid is ready to go because we've walked through, and I'm going to go ahead and just walk you guys through some samples here of what I'm talking about. If I can show you objectively that the left leg is similar in strength, coordination, control compared to your right leg, you're going to feel a lot better than that. So let's kind of get into the meat and potatoes of what I'd like to talk about here. What I'm going to first show you here is a single-legged vertical jump. A single-legged vertical jump is one of the standardized assessments that I like to do with all my athletes of the knee injuries as they try to get back to playing their sport, because it really isolates that leg. You really can't cheat yourself out of that, right? In this case, if it was the left knee, I can't use my right leg to compensate for it. And what you're looking at here is a quality motion. So here, I think you guys can see my mouse cursor, but if I see someone land like this, where their knee goes in, and they're not showing me that control, they might be able to land it quantitatively, right? They might be able to do that. If they show me that strategy right here, where their knee goes in, I know that knee is not being controlled. And if this was an MCL or heck ACL injury, I wouldn't feel too good about that. Now, if we went back to my original landing strategy, which was a good one, I'm in control, I've got good balance, my hip, knee, and ankle are all aligned well. So qualitatively, that shows me that this guy is doing well and ready to kind of move forwards. Another one that I want to show you guys, let me go ahead and load that for you here, is a single-legged forward jump. Now this one's a little more dynamic, which I like. So in this case, we would actually take the athlete through 3 sequential jumps. 1, 2, 3. Okay, so starting over 1, 2, Nearly bit it there. 3. So you want to see how far these people can go, your athletes can go, as well as the quality. I want to keep reiterating that. Most quality is pretty bad, I would say. People might be able to do it, but what's it looking like? So in that case, right, I just did a good job. I jumped 3 times. I would measure the distance, and I would probably have the athlete do that 2 to 3 times on each side, get a median average, and then also just kind of think about what did that look like qualitatively, right? 1. So like nearly lost my balance. And when I lost my balance too, as I go back here, I would also kind of pay attention to what was my landing strategy. In that case, I leaned to the right. I tend to be on the outside of my foot. So that gives me a lot of information as to maybe what compensations might be occurring. Now, so far, particularly for this one, because it's got a nice distance control to it, I like to see that each leg is within 10%, maybe even closer to 5%. So just to give you an example, just for simplicity, if I want 100 centimeters, just for, let's say, on the right, on the left, like let's say that was my bad leg, I'd want that to be closer to 90, maybe even 95. And then I'd want to see that the quality looked really good. All right, so let's move into the third one I want to show you, the hexagon agility test. Let me pull that up here. Okay, the hexagon agility test is stinking awesome. You could actually just you can see probably faintly on that floor that I've got some blue tape and I've measured out a pretty standardized hexagon. The one we've used for research is about 24 inches each segment. There's actually some pretty neat ways that you can create this without having to get too technical, but nonetheless, if you had your athlete lay down, and this is what we could even do for you here, we'd lay down kind of a hexagon, and what we do is, as I'm sampling there, we'd start double-legged, and I'd have you go around the hexagon 3 times, and we'd take a track, take a score. What I really like to do is get up into the hexagon agility test single leg. Boy, does this show us a lot of information. There's deviations, compensations, discomfort, pain. That's going to show itself when doing this, as well as fatigue and even just endurance of that leg. So I like to see that each leg has a pretty similar score, right? So it maybe took, let's just say, 15 seconds on each side. I'd want to see that really close to 15. I wouldn't want to see like one's 15 seconds, and then the other one would be 11 seconds. You know, we'd want to see that the quantity or the total time is pretty close. And then again, guys, I think where most therapists maybe let us down is the lack of insight on the quality of these movements. How are they compensating? Do they look comfortable when being really challenged? Because whether you're getting back to playing basketball, football, or wrestling, some of the principles are the same. How well can you handle load? Can you attenuate force? How strong do you look? And as you kind of throw up a gamut of different tests, basically at some point it's going to show itself if things aren't looking good. You really can't hide yourself from me or from us over here as we put you through the gamut of tests. Something else I just wanted to mention, the leg press. The leg press can be really insightful in the sense that I like to do a maximal strength test. Like just, what do we got? What's the strength? What do we have? So I like to do a single leg test, and we don't have to do like max rep, like we don't have to jeopardize any injury. We do rep max, and then there's just a simply formula that we could utilize to tell us what their max would be. And if there's a big deviation, things will show themselves pretty